Dear students, how are you doing today? So today we'll be talking about prefixes, another component of your medical terminology words. These are the words that come in the beginning of the medical terminology words. So let's talk about them. They're fun, they're relatively easier than the suffixes. So let's get going. So let's see. So word elements that are placed at the beginning of the words, they do change the meanings of the words, but not as significantly as the suffixes. As you remember from your previous lectures, suffixes, anybody remembers? What do they do? What do suffixes do? Suffixes do change the meaning of the word root or the medical terminology. Suffixes involve the diagnostic procedures. They do denote the pathology. Suffixes can changes. They can change singulars from plurals. They can be adjectives and they can be nouns. They can also be the diagnostic procedures and they can be diagnostic instruments as well. So they can give us a lot of information about the patient, right? So prefixes may not be necessarily the part of a medical term, and usually they are in English. So that is an important thing to keep in mind. However, they can tell us a lot of information. They can tell us about the position of a disease. They can tell us a position about a cell. They can tell us about position of a condition. They can tell us about a position of a graft or where it's coming from. Sometimes they can also tell us about the time. So let's talk about them a little bit. And again, it's important to realize that the root of those words can come from English most of the times. Not necessarily always, but most of the times it comes from English. Okay, so position, number and measurement, direction. But it is important to realize that they do change the meaning of the word. So I kind of lost all of my 5 pair of glasses. If you find me squinting, please just don't laugh at me. And if I make a mistake, let me know. I know my students are smart enough and they're paying attention. So, and I'm going too fast or too slow, just shoot me an email. So they do tell us about the position and number and measurement, direction, and other common prefixes are used to change the meaning of a word. So epigastric, intercostal, prenatal is before, postnatal is after, sub is below. So they're relatively easier. So life is easier, right? There is grass. Or I don't know what I'm saying. It's kind of late right now. So describe an amount, size, or degree of the involvement. Poly is multiple. Macro is large. What is micro? All of us know what micro means, right? You want to tell me? Little, small. Quadri is 4. Plegia is paralysis. Triceps. Anybody knows what triceps are? Has anybody been going to the gym? I have been going to the gym just a little bit this summer, even though it doesn't look like it, but anybody knows what triceps is? This back muscle with the 3 head. Right here, that's the triceps muscle right here. So triceps means 3 heads. So that's your triceps. Circumrenal is around renal, around your kidneys. Intramuscular is inside your muscle. Many of you might be going into nursing and other healthcare professions, so you'll be giving a lot of intramuscular shots. They're not fun, and many of you, I'm sure a lot of you might have had your COVID shots, your COVID vaccinations, and your flu vaccinations. So those are intramuscular. Paranasal is around your nose. Suprarenal is above your kidneys. We have some glands that are above your kidneys. Dyspnea. This means bad. That's what this means. And I know a lot of you know about it. So whenever there is a little bit discomfort or a lot of discomfort, that is bad. So when you have difficulty breathing, that's dyspnea. Eupnea, when you can breathe okay. Anesthesia. Anesthesia, N means without. Anti means against, right? That these are the terms, some of the terms you already know. Homo means homo means same. Graft means graft. So homograft is kind of like a graft that somebody would receive from one part of their body to another. The example would be if somebody has breast cancer, right? And they would after some time has gone by and their body has healed a little bit and they have mastectomy, which would be removal of their breast. So a doctor would probably remove some part of their muscle from a healthy part of their body, such as side of their thigh, and they would perform reconstruction surgery, and they will perform a graft where their breasts would be previously. I have taken care of a lot of patients who had breast reconstruction surgery, so then the growth would occur. So that would be reconstruction surgery, and those kind of surgery would be considered homograft surgeries. I think I probably skipped this, not skip, but we were talking about it. Endocrine, we'll talk about the endocrine system. Endocrine would be when the glands would be secreting. So that would be endocrine system. The glands are secreting enzymes. That's endocrine system. Suprarenal is above kidneys, like we talked about it. There are some glands sitting over there. So there are a lot of prefixes that you'll be practicing. Between would be inter, above and upon would be supra, after and behind would be retro and such, and under would be sub. So there are a lot of things that you will look at it, or hypo for deficient. Backward behind would be retro, I think. Before in front of us, in front and under below again would be sub or hypo and infra. So there are a lot of terms. Just it is important thing to keep in mind that prefixes could have a lot of, in context, there could be different terms, and in context of where exactly you're using those prefixes and which suffix and which condition or which situation you're using them for, there would be a different term, but they may have the same meanings. So just practice those. I'm not going to be saying it a lot of time. My daughter was looking at my previous lecture and then she said, "Mom, you told your students so many times, probably 5 or 6 times, that please make sure that you're looking at your textbook and make sure that you're doing your exercises and you're looking at your medical language lab." And I'm sure these students are already doing all those things, so please don't say that over and over again. So I'll try not to say it as much. So I'm sure you're doing all those exercises and you'll do it. So I'll try to do my best not to say it over and over again. So these exercises are actually fun. So this PowerPoint, this slide actually shows you the direction and position of some of the things. I wanted to explain it to you a little bit in detail. If you look at it, anything that is towards the midline of the body, that would be denoted by ab, like abduction, and anything that would be away from the midline of the body, that no, if it is away from the midline of the body, would be abduction, and if it's towards the midline of the body, that would be adduction. So towards the midline of the body is adduction, and away from the midline of the body would be abduction. Above is super, or above would be superior and supra. So through or across would be or like we talked about it, diagonal. Around would be para or circum, like we talked about it. Outside has a lot of terms, ecto, exterior, and such, and there will be a lot of terms. Oh, there we go. Exo, extra. So dia, through, across, and trans, circum, and peri, para, they're all around terms. So just go through them. I don't expect you to know all of them, but it will help you to know some of them. Many of them you already know, and I'm sure you use them. Hetero, I wanted to give you an example of hetero, just like I gave you an example of homograft for mastectomy. Heterograph would be an example where we take some organs for implants, and we take them from different species and we implant them on different species. And so there have been some experimental transplants. Some experimental transplants. So those kind of grafts are called heterografts. And you have some examples in your book, so I would recommend that you look at them. Please don't count that one that I told you to look at your textbook. So mal or dysfunctional would always be bad. Utopia, just think about it. It's a good world, so utopia, good and normal. Bad is bad, dysfunctional. Dystocia is a bad birth when somebody is giving birth. Union, together, and join is sin. In synchrony, just think about it that way. So that's how I try to remember words. I try to make a connection, and that's how I remember. So that's what will help you in medical terminology. Oh, there's that picture. I didn't remember when I was making this PowerPoint. So that would be a remember of heterograft. So it is from this nice Mr. Pig, and he is volunteering his heart, and then it's being transplanted to the human beings. A human being. I'm not quite sure how successful those transplants have been. Look it up. But this would be considered a heterograft, and this is actually from your textbook. This picture is from your textbook. So there are some more exercises. So you can quadriplegia, 3 heads. Remember our tricep muscle right here. And pertaining to one nuclei would be uninucleus. So there are some more. You can try those, and that would be it. This is a relatively easier secret to secrete within would be endocrine system. The glands that would be secreting within those glands and tubules, that would be endocrine system. We will talk about it in detail in this class. Though that endocrine system is very, very interesting. You'll find it very interesting. We'll talk about it in detail when the time comes. So, and then within the skin, I have this diagram for you where you can see the intramuscular, intradermal, and subcutaneous and intramuscular. Those are different kind of injections. When many of you will go into the profession, some of the healthcare professions. Let me move this camera a little bit so you can see this a little better. Pertaining to under the skin, that would be subcutaneous, hypodermal, and subnasal would be under the nose. Paralysis would be hemiplegia, half of the body. When people have stroke, that would be one of the example where half of the body is effective. Double vision would be when people have vision problems, and sometimes they're tired. Some blood pressure medications, and a lot of medications have side effects when people have double vision as well. So that would be diplopia. So those are the things to keep in mind. Right. So again, pertaining to 2 sides, pertaining to the period before birth, that would be prenatal. Pertaining to between the ribs would be intercostal, and then again some more words, exercises for you. Okay, so this is it. So it was pretty easy. Prefixes are pretty easy and very interesting. So let's see if we can what do you think so far? I hope all of you are doing good with this PowerPoint and with this class so far. I think it is actually very interesting. Medical terminology is a very interesting class. So let's see. I just wanted to show you something from your textbook real quick. If you look at your textbook, there are some very interesting tables, and some of the pictures that I took are from your textbook. And there are prefixes for position that we talked about, and there are a whole lot of prefixes here, and the exercises that we did in your PowerPoint. And then again, the abduction is away from the midline. You can see that picture right here, and the adduction towards the midline right here. You can see that. And you have very good tables here, 3.5 and 3.4. I'm trying to see without my glasses, but I think I'm doing okay. Table 3.3. So there are very nice pictures here. And there we go. There is some, I think it's from the gluteal muscle. I told you thigh, but they're saying the autograft is in which tissue from the patient's buttocks is transplanted to her breast. So this is from the buttocks, not the thighs. My apologies. See, sometimes teachers can make mistakes too. So I'm glad we read it together. And this is heterograft. Yeah. So this is an example of heterograft. So it's good to look at these at your textbook, so it reinforces the content. All right, so I hope this lecture helped you, and you guys have a great week. Thank you so much. That's all for your prefixes lecture. All of you take care. Bye-bye now.